Hey, Dr. Ian here, Dr. Autoimmune. By the end of this video, you're going to have a tangible understanding of why you continue to have symptoms even if you've had a thyroid disease diagnosis. For the past 17 years and over 6,500 patients, my job has been simply to educate my patient about their root cause, give them actionable strategies, and track their progress so not only do they feel better, but they can see that the labs also back that up. So if you're dealing with a thyroid condition, come with me for the next 7-8 minutes here as I talk through what you're dealing with, what I typically see, and what you can do different so you can stop this vicious cycle and start living the life that you deserve. So for most people, right, that have come and worked with me over the years, they've said, hey, I've got this marker, TSH, called thyroid stimulating hormone, which is actually a pituitary marker, right? And when it was high, right, they said, well, now I have been told I have hypothyroidism, and as a result, we need hormone replacement therapy the rest of their life, right? That's what happens when you ask them, how long do I take this the rest of your life? And most commonly in the version of levothyroxine. Now, levothyroxine, interestingly enough, two very common side effects are fatigue and worsening of your constipation. Just take note of that for a second, and then I'll explain more of that in just a second. But again, your TSH, once you're given levothyroxine, might look better on the labs, but what you don't understand is that as soon as you have an elevated TSH, you have a 9 out of 10 times, 90% chance of having something called Hashimoto's. So you may know that already, you may not, but that requires, right? That requires additional lab testing, thyroid peroxidase antibodies, and anti-thyroglobulin antibodies. So you've got additional lab testing, of course, that we run on all of our patients as part of the 65 marker panel that we send you to LabCorp for. But understand, right, in 2013, I was already involved in working with thyroid disease because of the autoimmune connection. Well, again, a nationally recognized, award-winning documentary and pharmacist, her name was Isabella Wentz, produced this program called The Thyroid Secret. So you can get more information about her on her channels, but she actually had my patients on her award-winning documentary, and that's really where things exploded for my practice working with thyroid patients. Because again, they started to get, as many people do, frustrated, right? That they're not treating the cause and they're being treated as a number. So what we want to do, right, is understand what are the deeper issues going on here, and what else is really going to take place if we don't take action. Because we know that people, right, that have Hashimoto's already have a 50% chance of having a second autoimmune disease. Now again, what's very consistent in, right, autoimmune disease is that one, right, there is genetics, right? 2, there's environmental issues, and 3, there's triggers, right? So when you talk about triggers, that's where people really start to, again, understand why they have a thyroid condition. And what I mean by that is that very consistently, you'll see a strong past history of antibiotic use, medication use, treating infections that wiped out the beneficial bacteria in their gut. They have a strong history of blood sugar issues that led to menstrual problems, which then led to birth control pills, and typically also because of a gene called MTHFR, right? Genetic predisposition for an autoimmune disease. And with these subsequent issues, now we've got gut problems in your future, right? Because usually that then leads, right, to IBS, and very consistently, it also leads people down a process, right? These two issues commonly leads to gallbladder problems. So again, you can try to remove the organ, or you can try to remove the thyroid gland. but it's not going to fix your issues because you're not focusing on the reason why you have issues. And I just mentioned two right there that we heavily emphasize in our practice. One is insulin resistance and dysglycemia, blood sugar dysregulation. And two is going to be your gut health. Because those three things I mentioned, genetic predisposition, environmental factors, and triggers, cause leaky gut. Leaky gut, also known as intestinal permeability, right? Remember, as soon as you have high TSH, 90% chance of dealing, right, with a condition called Hashimoto's. 50% of people then have a second autoimmune disease by the time they actually get diagnosed as hypothyroid. But what you may or may not understand is that if you have an autoimmune condition, right, there was something prior to that called intestinal permeability, aka leaky gut. So in functional medicine, and any good alternative medical practitioner is going to say, why do you have this? Well, there's 8 common causes of leaky gut. That's what we test for in our practice. That's the value that we bring. And with our clinical nutritionist, with our dietary interventions, with the tracking that we do, with the individualized supplementation, because you don't want to just throw a thyroid supplement at this problem. In fact, taking thyroid supplements many times will make your symptoms worse. So this is where we stop, we slow down, we listen to you, and we start to take data. We collect additional information, such as maybe you do need to look into stool testing. Maybe you do need to track your blood sugar over time. Maybe we do need to know if you have gluten sensitivity or if you have a estrogen connection. Because again, keep in mind, if you have, right, blood sugar issues, you're going to surge insulin. And you're going to fatigue after meals, and you're going to crave sugar after meals. And that is, again, a dead ringer that you're probably likely having insulin resistance. And again, if not only do you might have IBS, but if you have gas and bloating after meals, that is bacteria being replicated, and that is fermentation. That means, again, what's happening here in your gut is no longer just here in your gut, meaning it's now outside of your gut, and that inflammation is right here. So take a step back with us. Let us ask better questions. Let us understand those root causes through a very comprehensive initial paperwork process, right? A very comprehensive lab process and a health advisor evaluation where we can plot where your systems are going wrong, and we can actually create a plan for you, an actionable plan where you have repeat markers, where we track you, where you have visits, where you don't have people gaslighting, right? We don't have people saying, oh, you need to go get a psychiatric medication for your symptoms, or there's nothing more that I can do for you, or it's just hormonal, or your mom had it so you have it, or that's just something that people get as they get older. I've heard it all. And you may have heard it too. But what I'm telling you right now is that you have the opportunity to change your life. I don't know why you need to change your life. Maybe it's for your spouse. Maybe it's for your children. Maybe it's just for yourself. Because you're sick and tired of being sick and tired. So if that's you, I want you to click the link below. I want you to fill out your information. And you're going to speak to our new patient coordinator. And this young lady is going to educate you about how systems, again, cause symptoms. We're going to get you excited because, again, we rarely have failure. The vast majority of our patients are succeeding because we're finally focusing on you, your inflammation, your goals, and we're targeting the root cause. Again, my name is Dr. Ian with Dr. Autoimmune, and until next time, let your health soar.